Diabetic ulcers are one of the leading causes of amputation, so it's really, really, really important to talk about this. So I want to welcome our brand new, I'm very excited about this, the way to my heart's Senior Advisor of Podiatry, Podiatrist Stacia Jones. Thank you so much, and we're so excited to have you, Stacia.
Hi, everyone. I'm really excited to be here. Currently, right now, I work for the government, but before I was working for the government in my private practice, I had a PAD screening that I did for all of my patients that met certain requirements. So it's a group of questionnaires. And if you go to a doctor that does that, that's a good sign. That means that doctor is in the know of PAD and how important PAD can affect your life. And so certain patient population, we had a PAD screening that we did, which is a baseline of questionnaires. And based on if you answered yes or no to those questions, it was things like if you had pain in your feet or cramping, if you were over a certain age, 50 years and older, if you had a history of smoking. It's about 10 questionnaires. And the more you answered yes to those questions, the higher risk you are for getting PAD. And then based on that, we had a non-invasive, there are non-invasive vascular studies podiatrists can do in their practice, or they can send you out to a facility, a vascular facility that does non-invasive studies. So we used to do a non-invasive, which is what you mentioned early, an 𝗕𝗶𝗿𝗀𝗀𝗍 index. And we would do one in our office, and based on the results, we had a vascular surgeon that read it and basically tells the patient was high risk. The high risk patients obviously automatically got sent out referral to a vascular specialist to get some type of intervention done. But a lot of times, not all doctors or podiatrists are doing those things. So as far as patients are concerned, like you said, it is important to go to a doctor, even though they might not know that I had that background, but I am also board certified in diabetic wound care, and not all podiatrists are. So if you're a diabetic and you actually have an ulcer, you want to focus on providers that have possibly a wound care certification like I do. And I also was working at the wound care center at the hospital every week. So if you're involved with a podiatrist or a vascular surgeon or a general surgeon who works at the wound care center, they're going to be more aggressive in treating your diabetic ulcers.
That is such a good point, Stacia. I had no idea. When a person is at the primary care physician and at that appointment, and that primary care physician says, hey, we need to refer you to a podiatrist for that sore on your foot, you need to take your healthcare into your own hands and say, hey, doc, are they wound care certified?
Yes, absolutely. It helps. And as a wound care specialist, when I was at the wound care center, I just had a protocol for brand new patients. Normally, when a patient shows up to the wound care center, it tells you one of two things. They've already been treated by whatever doctor they were going to, whether they were going to a podiatrist or they were just being seen by their primary care. They were already seen, and that doctor has finally decided they can no longer treat them. And that's how they end up at the wound care center. So when they end up to us, it's kind of like too late. So what our goal is and what her organization goal is you don't want to wait to that point. And yeah, I did save a lot of limbs, and I didn't amputate every single patient that I saw at the wound care center, because the wound care center we have hyperbaric, we have a lot of other treatment options that you don't have in private practice to help heal the wounds. But the goal is to get you guys before you get to the point where you're being outsourced to a wound care center, because normally at that time it's kind of too late.
Right. And that's why it's really important to take a comprehensive, multidisciplinary approach. When you're at that primary care physician, who is the gatekeeper for so many people with PAD around the world, you need to say, okay, doc, let's get the podiatrist with that wound care certification. Let's get a vascular specialist. And this, especially for the diabetic ulcers, someone that has that pedal loop experience, going down into the foot, into the arch of the foot, and being able to take a wire and at very least a balloon to push a little bit of that plaque aside so more flow can get to those toes. But then also that endocrinologist, because you need to get your blood sugar under control. Is there anything that you think that you would add to that?
Besides having a comprehensive team approach, that's very important. So you'll have your primary care, a podiatrist, vascular surgeon, endocrinologist, maybe a diabetes educator. The hospital where I was at the wound care center, we had one, and I was noticing a lot of my diabetic patients whose A1C was above 8, they never even heard of a diabetes educator. So I always recommend they go to them, because a lot of times the primary care doctors, they're really busy and they don't have time to address every little specific needs for all of their patients, especially if they had a higher, workload. And also the location is very important. Some areas you're going to have access to better resources, when you're in a bigger city versus a rural area, and some of those areas that are really isolated, they're not going to have they're going to have one vascular surgeon on staff, and he or she might not know how to go and address the pedal pulses and open it up the blood flow. So they're used to doing what you and I discussed a couple of days ago, Kim, the ones that with the femoral arteries, above the knee. Yeah. And you will see the difference. Like you said, you can get a rating and see how many of those above the knee amputations that vascular doctor ends up doing versus the ones that, they're not doing them above the knee. So yeah, it does make a difference with location and having access to a plethora of different types of doctors when you're in a bigger location.
And something that's really important is that if you do have one of these revascularizations or an endovascular procedure where you go under the fluoroscopy and they go in through a little keyhole entry point with catheters and wires and balloons, and maybe what's called an atherectomy device, which is a device that physically removes the plaque. You might, it might be a laser, it might be a roto-rooting device, that you do need to make sure that you have an appointment with that podiatrist, especially if you have a wound on your foot, because that's a team effort. You have to go from revascularization to debridement. That's really important.
Yes, and that goes back to, again, having a comprehensive approach, because a lot of times that's what I was doing in the wound care center. Initially, as soon as when I saw someone, I did the screening for PAD. If they were positive for the screening questions, I automatically outsourced them to a vascular provider. And because of my experience, I know which vascular doctors, not all vascular doctors are the same, but like the other vascular doctor said earlier, not all of them are trained. He said, I think 10% are trained in that part. And so that makes it really hard for me as a podiatrist, because initially I was just referring to a specific vascular surgeon. Then when I was seeing the patients, ulcers were not healing, they were still being chronic and they weren't getting enough blood flow, then I switched and started. And now after a while, you know who to send all your patients to. And that was like, pretty much you build relationships and you learn more. And you're like, okay, I notice whenever I send to this vascular surgery, when they come back to me for the wound debridement, the wound heals. So blood flow is very, very, very important. As a podiatrist, we cannot get the wounds to heal on our own. We definitely need the blood flow, and we need the vascular specialist with that key training to be able to open up the blood flow below.
You bring up a really good point, a good critical question to ask your primary care physician. But when they make the referral either to a vascular specialist or a wound care specialist, to say, what are the outcomes of those patients that come back to you? Are they getting their toes and feet amputated, or are they still walking today? I want to go to that podiatrist and that vascular specialist in which those patients are still walking today. And I think that's so important. We have a question coming in from Mark. How do you know if an ulcer infection requires amputation? Many surgeons and podiatrists tell patients the infection is to the bone, we got to amputate. How do you know as a patient?
It's a combination. It depends how critical your diabetic foot ulceration is. If you have an infection, if you have PAD and you have neuropathy and you have an elevated A1C. So if your A1C is over 10, which a lot of my diabetic patients, I showed up in the emergency room when I took call for the hospital, they always had an A1C over 10. And also if they had a white count. So all of those factors increases your chances of losing that toe. But if you have someone that has a stable ulcer, 9 times out of 10, we can heal it within a month or 2 months with just wound debridement, controlling, especially if it's not infected. So the chances of you getting your toe amputated is a combination of all that. And if it probes to bone or you have exposed bone, it's called osteomyelitis. That's the medical terminology for a bone infection. And there's 2 schools of thought. Some doctors at the hospital say, you know what, we're just going to give you 6 weeks of IV antibiotics and we'll try the conservative treatment first. And if you don't heal, then you have to get it amputated. And sometimes some doctors, based on the comprehensive of how it looks, if it's really bad, you don't have a choice. You have to get it debrided or amputated.
Are they preventable? Are these ulcers preventable? Can you detect them early on before they even break through the skin?
Absolutely. Based on the screening tests that I told you about, the patient's past medical history, I have both of my parents have diabetes. And do I think they're going to get a diabetic foot infection? No. Even though I'm a podiatrist, I don't live in the same state as my parents. And so, but just clinically, their A1C is controlled, they exercise daily, they eat healthy. So just a combination, their nutrition factor is normal. So a combination of things that's going to tell me that I don't worry about looking at my mom or my dad's foot when I go home for the holidays. But some of my patients in the office, clinically, their skin is dry. Their toes are already starting to turn dark. There's some clinical signs that shows that, okay, this person is probably going to end up with a diabetic ulcer. And then those are patients that you want to hold in on right away. So we can refer them to get diabetic shoes, educate patients on what type of shoes to wear. And also making sure they're getting their blood sugars under control. That's a big thing. And, trying to be healthier and just keeping everything. If you have normal blood values every single year when you go to your primary care as a diabetic, the chances of you getting a diabetic foot infection is very low.
And I want to finish with this question from another one of our patients, Bill. He is asking about shoes. You mentioned shoes, diabetic shoes. That's one of the most popular questions that I've seen across social media. What shoes should I get?
Yes. So a lot of times the insurances do pay for, Medicare does pay, and certain other insurances as well, depending on your region, they will pay for diabetic patients to get shoes. You have to have a risk factor, and PAD obviously is one of them. Diabetic neuropathy is another risk factors, but just because you have diabetes doesn't mean that you're eligible based on the guidelines to get these shoes. Like my parents will not be eligible because they don't have the risk factors besides just being a diabetic. So there's, as long as you meet those risk factors, you can. But even though my parents are not eligible to get diabetic shoes through the insurance, there are certain shoes that I tell, like my mother, I don't want you to wear these shoes. Like these are the shoes. So there's certain brand companies, Safe Step. There's quite a few out there, and those are the websites that I would refer patients to get shoes. Even though they're not diabetic shoes, but they have some of the same similarities that diabetic shoes have. They have the comfortability. They might have an insole for support and things of that nature.
Thank you so much, Stacia Jones. We appreciate you so much. So thankful to have you now as our senior advisor for podiatry.